Did you know about this? Tuberculosis, often shortened to TB, is a disease that's been around for centuries. You might have heard of it, but you probably don't realize the global impact it still has today. We're going to uncover 5 shocking facts about tuberculosis that you absolutely need to know. Whether you're a student, a healthcare professional, or just someone who wants to be informed about their health, this video is for you. We're going to break down complex medical jargon into easy-to-understand explanations, empowering you with the knowledge to protect yourself and your loved ones. So get ready to have your mind blown as we delve into the often overlooked world of tuberculosis. Let's get started. Tuberculosis is one of the top 10 causes of fatalities worldwide. Let that sink in for a moment. This isn't a disease of the past, it's a present danger affecting millions globally. Each year, over 10 million people fall ill with TB, and sadly, over 1.5 million lose their lives to this preventable disease. That's more than HIV, AIDS, and malaria combined. The World Health Organization, WHO, estimates that a quarter of the world's population is infected with TB bacteria. Most of these are latent infections, meaning the bacteria are dormant and not causing illness. However, these latent infections can become active, especially in individuals with weakened immune systems. This makes TB a major public health concern, particularly in developing countries with limited healthcare access. We need to understand the magnitude of this disease to effectively combat it. Knowledge is the first step towards prevention and eradication. When you think of tuberculosis, you probably picture a cough and think of the lungs. While it's true that TB commonly affects the lungs, pulmonary TB, it's not limited to just that. Tuberculosis is a bacterial infection that can spread through the bloodstream and lymph system, reaching various organs. This is what we call extrapulmonary TB. It can attack the kidneys, causing pain and urinary problems. It can affect the spine, leading to severe back pain and even paralysis. And in some cases, it can even infect the brain, causing meningitis, which is inflammation of the membranes surrounding the brain and spinal cord. Don't let the misconception that TB only affects the lungs give you a false sense of security. Understanding that it's a multi-system disease is crucial for early detection and treatment. Tuberculosis can be a silent threat. Why? Because it can stay dormant in your body for years, not causing any symptoms. This is known as latent TB infection. You can have latent TB and not even know it. You won't feel sick, and you can't spread the infection to others. However, the bacteria are still there, hiding in your body. Now, if your immune system becomes weakened, say due to stress, malnutrition, or other illnesses like HIV, the latent TB infection can reactivate into active TB disease. Active TB is when you experience symptoms like persistent cough, chest pain, fever, weight loss, and night sweats. You can also spread the infection to others at this stage. Understanding the difference between latent and active TB is vital for effective management and prevention. If you suspect you've been exposed to TB, it's crucial to get tested, even if you don't have symptoms. Tuberculosis is already a serious disease, but it becomes even more challenging to treat when the bacteria develop resistance to the drugs used to kill them. This is what we call drug-resistant TB. Drug-resistant TB is a growing problem worldwide. It occurs when TB bacteria mutate, making the standard drugs ineffective in killing them. This means longer, more complex treatment regimens, often with more toxic and expensive drugs. Multi-drug-resistant TB, or MDR-TB, is resistant to at least 2 of the most powerful first-line TB drugs. Extensively drug-resistant TB, or XDR-TB, is resistant to even more drugs, leaving very few treatment options. Drug-resistant TB is a serious threat to global TB control efforts. It's crucial to take your TB medication exactly as prescribed and complete the entire course of treatment to prevent the development of drug resistance. The good news is that tuberculosis is both preventable and curable, especially when detected early. Early detection and treatment are key to preventing the spread of TB and reducing the risk of complications. Vaccination is a powerful tool against TB. The BCG vaccine, while not 100% effective, offers significant protection against severe forms of TB, especially in children. If you're diagnosed with active TB, you'll need to take a combination of antibiotics for several months. It's crucial to complete the entire course of treatment as prescribed by your doctor, even if you start feeling better. Maintaining a healthy lifestyle, including a balanced diet, regular exercise, and adequate sleep, can strengthen your immune system and reduce your risk of TB infection. Remember, TB is a treatable disease. By working together, we can stop the spread of this global epidemic. We've covered a lot of ground about TB, but let's talk about the best line of defense prevention. And when it comes to TB, the BCG vaccine is our #1 weapon. The BCG vaccine, named after the scientists who developed it, Bacillus calmette-guerin, is a weakened form of the bacteria that causes TB. Don't worry, it won't give you TB. Instead, it trains your immune system to recognize and fight the real deal. While it's not 100% effective in preventing all forms of TB, it's incredibly effective in protecting children from the most severe forms of the disease. The BCG vaccine is usually given to infants in countries where TB is common. It's a simple injection, and while there might be some mild side effects like redness or swelling at the injection site, it's generally very safe. The BCG vaccine is a testament to the power of immunization. It's a simple, cost-effective way to protect our most vulnerable populations from this potentially deadly disease. There you have it, 5 shocking facts about tuberculosis that everyone should know. It's a global health threat that demands our attention, but it's also a battle we can win with awareness, prevention, and timely treatment. You have the facts and the strategies to prevent tuberculosis. Stay safe and stay healthy. Don't forget to like, subscribe, and share the message. Comment if this information was helpful. Prevention is power.